Hello dear medical students. In this particular skill station, we are going to learn about a very important examination, that is examination of throat. Examination of throat is principally divided into three important subsegments, and we are going to take each and every segment separately. In the first segment, we'll see the examination of the oral cavity and oropharynx. Then we'll do the examination of larynx, which will be through indirect laryngoscopy. And then we'll learn about what is the examination of neck. So in this particular station, I'm going to cover about the first and principal subheading, that is what is examination of oral cavity and how do you do oropharyngeal examination. So I have a volunteer with me sitting in a well-lighted room. First, I need to build a rapport and take a formal consent from the patient. हेलो, कैसे हैं आप?
बढ़िया सर।
ठीक है, मैं आपके मुंह के अंदर कुछ एग्जामिनेशन करूंगा, राइट? उसके लिए मैं एक टंग डिप्रेसर नाम का एक इंस्ट्रूमेंट होता है, उससे मैं आपकी जीभ को नीचे करूंगा। तो क्या मैं ये कर सकता हूं, देख सकता हूं?
हाँ सर।
ठीक है। Once I have told what is going to happen to the patient and I have obtained a formal consent, then I will proceed on with the examination. Now notice carefully. First I am going to go from the oral cavity और उसके बाद we are going to go into oropharynx and I am going to tell you separate headings कि आपको किस तरीके से oral cavity से oropharynx तक क्या-क्या एग्जामिन करना जरूरी है. So first and foremost is always remember the oral cavity starts from the oral commissures. यानी lips are a part of the oral cavity. So the first thing is you need to notice the lip area. अब lip में क्या-क्या चीजें notice करनी है? The angles of the lip on both the sides here, these are called as oral commissures. Then you have got this is the upper lip, this is the lower lip. Can you see a line or a demarcation present between the skin as well as the mucosa of the lip? This border of the lip, this is called as the Vermilion border of the lip. You can see a small protuberance or a projection on the upper lip in the center. This upper lip projection or in the center, this is called as a upper lip tubercle. Now, can you see this has gone down like a triangle, the upper lip? So that center triangle which forms in the upper lip, that's given the name as Cupid's bow. In the center just above the Cupid bow, this particular area where his mustache is present, this is called as a philtrum. Now you can notice one important fold below the lower lip. This is called as a mentolabial fold, also called as a mentolabial crease. Just as you have got one fold over here, which is called as a nasolabial fold or a nasolabial crease. This is the lip examination. I'm going to see the color of the lip, the symmetry of the lips, any particular lesion of the lip, any particular crusting of the lip, which is very, very commonly seen. Now, once I have done the lip examination, now I'll gently tell the patient to open their mouth. But before opening the mouth, I need a headlight. So now for doing an internal examination, now I'll go ahead with wearing a headlight and I'll again open it with the switch. Now I'm going to gently tell the patient to open their mouth. क्या आप अपना मुंह खोल सकते हैं? For this, I'll utilize an instrument which is called as a lax tongue depressor. Now this is a very important instrument which utilizes for oral cavity and oropharynx examination. Now first, once I have carefully, I need to go inside. क्या आप नीचे अपना सर करेंगे? Okay. Now the first thing is, as soon as you open the mouth of the patient, the first thing that you notice is about the breath of the patient. So if the breath of the patient is having, if it's having a foul smell, that's called as halitosis, which can tell you about the orodental hygiene, right? Now, the second thing that you notice inside when you go inside is the mouth opening. Mouth opening normally should be more than 35 millimeters. In general, we usually take the inter-incisor distance with the help of a vernier caliper. पर अगर आपके पास नहीं है, तो you can utilize 3-finger assessment test. What is the 3-finger assessment? Usually the pulp of our each finger is around 12 to 14 millimeters. Normally our mouth should open more than or equal to 3 fingers. तो क्या आप mouth पूरी तरीके से open कर सकते हैं? Okay. If you can see easily my 3 fingers are going in, that means he has got a normal mouth opening, which means he has got no restriction or trismus. Okay. ठीक है, relax करिए. अब, now we are going to see about the next aspect of oral cavity, that is the gums or gingiva, upper and lower as well as the teeth. आप क्या अपना मुंह खोल सकते हैं? So now I'll gently retract the buccal mucosa and I am going to see like this. Can you see this? I'm going to gently retract the buccal mucosa and I'm going to go up in my vestibule. So this space here, this space above and below, this is called as an oral vestibule. So I'm just going in and dipping my tongue depressor, seeing all the teeth as well as the lower and upper gingiva. So it fairly is a good orodental hygiene. He doesn't have any tooth caries or any kind of tooth misalignment, or there are no tooth which are missing. So we'll check about the upper as well as the lower dentition together with the upper and the lower gingiva. Now, once you have finished the upper and lower gingival as well as the tooth examination, now you will move on to the lateral aspect, what is called as the buccal mucosa. Now, once you want to see the buccal mucosa, you'll take your tongue depressor and you'll open the mouth of the patient and you'll slightly or gently retract the buccal mucosa. You see the color of the buccal mucosa, see for any visible lesions, any visible growths in the buccal mucosa. Now, an important aspect in the buccal mucosa is that at the upper side of the buccal mucosa, at the level of the second molar, so this is the second molar, at the level of the second molar tooth, if you carefully visualize, you can see a small opening over here. Can you see this small opening? This opening is called as the opening of the parotid duct, which opens at the level of upper second molar tooth. So I am going to see this swelling, and at the same time I am going to put my finger inside and I am going to palpate this swelling as well. Now, why is that? It's because many of the times this swelling or this particular area where the parotid duct is opening, this might contain granulations, or it might be stenos, or it might be blocked. So it can be well palpated at the level of the upper second molar tooth. What is the parotid duct called as? It is called as Stensen's duct. The same I will go on to the opposite side, dipping my tongue depressor and seeing the upper as well as the lower end of the buccal mucosa. Now, one very important part is that can you see a potential space between the gums and the buccal mucosa above and a potential space between the gums and the buccal mucosa below? So, I am going to dip my tongue depressor in this space and open it. This is called as a Gingivobuccal sulcus, upper as well as lower. Now, always notice this is the very common area where you will find tobacco chewers putting their tobacco or any type of chewing tobacco is put over in this pouch. Very commonly, you might find hidden cancers or malignancy of the oral cavity in the lower gingivobuccal sulcus. So, I'll inspect the upper as well as the lower gingivobuccal sulcus on both the sides. This finishes my buccal mucosa examination. Now, the same way, I'm going to dip it anteriorly also, and I'm going to see the space between the lips as well as the gingiva. This is called as the gingivolabial sulcus. Labial means lip, gingiva means gums. Similarly, in the upper side, I'm going to just put my tongue depressor like this, and I'm going to see the gingivolabial sulcus on the upper side as well, right? So this finishes about what are the lateral gingivobuccal sulci and the anterior gingivolabial sulci. Now, once we have done the lateral aspect of the oral cavity, now we'll come into the center, which is called as oral cavity proper. Now, once we come into the oral cavity proper or in the center, you can see that there is the hard palate above, and the hard palate is characterized by these palatine rugae. So you can see there are multiple palatine rugae which you will be able to notice over on the palate, and you can see a midline palatal raphe as well. This hard portion is called as a hard palate. Always remember, the color when it changes from the hard palate to the soft palate, you can see a differentiation of the colors between the two. The hard part of the palate is called as hard palate. The soft part of the palate is called as soft palate. Soft palate is not a part of oral cavity. It is a part of your oropharynx. So the junction between the hard palate and the soft palate is the area above which demarcates the oral cavity to the oropharynx. Okay? Now let me come down. I look at the tongue. Now, if you see, क्या आप अपनी ज़बान को बाहर निकाल सकते हैं? If you see, this is the dorsal aspect of the tongue. These are the lateral aspects of the tongue. And if you notice this tongue, the dorsal aspect contains many kind of papillae, which are nothing but the taste buds of this person. Now, always remember the anterior 2/3 part of the tongue is in the oral cavity. The posterior 1/3 part of the tongue is inside the oropharynx. The demarcation between the anterior 2/3 and posterior 1/3 is by circumvallate papillae. तो क्या आप जबान बाहर निकालेंगे पूरी? So if you notice, the posterior 1/3 has got these bulges. These kind of bulges which are present at the posterior part, these are the circumvallate papillae. Don't go towards the circumvallate papillae because that might lead to posterior one third of the tongue, and that will lead to gag reflex. So always gently depress, अंदर रखिए ज़बान, gently depress the anterior two third, the patient is quite comfortable. Right? This is called as the oral tongue. Posterior one third is called as the oropharyngeal tongue. Now I am going to examine the ventral aspect of the tongue. अपनी ज़बान ऊपर करेंगे. So see, this lower aspect, this is the ventral aspect of the tongue, and you can see that this tongue is getting attached to the floor of mouth by an important median fibrous band, and this fibrous band is called as the lingual frenulum. Now, on each side, can you notice these two important blue structures? These are called as the deep lingual veins, which are very prominent on the ventral surface of the tongue. Now, one important point. On each side of the frenulum, there are openings which are present for the submandibular glands, which are given the name as Warton duct papillae. Now, this is the ventral aspect of the tongue. Below that, when you palpate, this is the area for the floor of mouth. Fine. Once we have completed the buccal mucosa examination as well as the gingival and teeth examination, now there is a very important site which you need to notice, which is very common malignancy site of oral cancers, and that is also called as the Coffin's corner for ENT surgeons. Now this particular area is present behind the base of the third molar tooth, and this is called as the Retromolar Trigone. So for that, I am going to again open the patient's mouth, and if you see, this is the third molar, and behind this third molar, अपनी टंग को एक तरफ करिए. Behind the third molar, this particular area, what you can see behind, this area is given the name as the retromolar trigone. Now, this retromolar trigone is the area which has got the maximum chances of hidden malignancies, and if this happens, then the patient requires to undergo a mandibulectomy in oral cancer resection as well. Now, I am going to proceed on to the examination of the oropharynx. So, remember that always the hard palate and the soft palate junction superiorly is the junction of the oral cavity and oropharynx, and inferiorly the tongue, the junction between the anterior two third and posterior one third of the tongue, which is marked by circumvallate papillae, is the one which demarcates your oral cavity from oropharynx. Once we have finished the oral cavity examination, now we move on to the oropharyngeal examination, where we will see different structures of the oropharynx. Now, आराम से छोड़ दीजिए. So I have depressed the anterior two third. You can visualize the soft palate, the center part which is hanging down the uvula, the anterior pillar, the posterior pillar. In between them, the tonsillar fossa containing the tonsil, and posteriorly you can see the posterior pharyngeal wall. This finishes my complete oropharyngeal examination in detail and what are the structures that are seen inside the oropharynx. So once I have visualized the oral cavity as well as the oropharynx, now comes the part which I cannot see with the naked eye. For that, I'll require a mirror. So in the next segment of throat examination, we'll move on to how do we proceed with indirect laryngoscopy for laryngeal examination. Now, once we have finished how to examine the oral cavity and oropharynx, in one particular diagram, I'll show you how to draw this over in your exams and show diseases. So for drawing the oral cavity and oropharynx, सबसे पहले हमें क्या करना है? हमें एक मुंह खुला हुआ draw करना है. You have to draw an open mouth of a patient. Open mouth बनाने के लिए एक elongated circle बना लेते हैं. तो ये एक elongated circle है. This is the open mouth of the patient you are looking inside. अब सबसे ऊपर क्या होती है? You have got your upper lip. सबसे ऊपर हो गई हमारी upper lip. तो ये हो गई हमारी upper lip, which you will mark over here, right? And then easily you can find this is your lower lip, जो हम नीचे लिखेंगे. This is your lower lip. Okay? This is an easy way just to show pathologies. अब ये आप दांत बना दीजिए. So this is obviously your maxillary teeth. What you are showing a glimpse over here, and these are your mandibular teeth with the alveolus, which you are showing over here. So these are the mandibular teeth, right? And these are the maxillary teeth, which you are showing above. ओके अब किसी का भी मुंह खुला हुआ है तो सबसे पीछे मैं आपको पहले ओरोफैरिंक्स के स्ट्रक्चर बना के दिखा रहा हूं. तो ओरोफैरिंक्स के स्ट्रक्चर क्या होते हैं? तो उसके लिए मैंने आपको बताया सेंटर में एक प्रोजेक्शन है जिसे कहते हैं यूविला. देन यू हैव गॉट टू पिलर्स ऑन बोथ द साइड्स. कौन से हमारे पिलर होते हैं? एक पिलर होता है एंटीरियर पिलर, विच इज मेड अप ऑफ पैलेटोग्लॉसस मसल. पीछे होता है पोस्टीरियर पिलर, ये हमने देखा. This is your posterior pillar, which is made up of palatopharyngeus muscle, and इसके सेंटर में इस फोसा को कहते हैं tonsillar fossa. Tonsillar fossa, which is an area which contains a very important structure जिसे बोला जाता है tonsils. So this is how you draw your tonsils. This is how you depict your tonsils. So these are your tonsils. Right? What else you will see in the oropharynx? On top, you will see the soft palate. ये हो गया आपका soft palate. Soft palate के आगे क्या होता है? You will see hard palate. And hard palate में आपको मैंने दिखाया भी है that you will find rugosities. ये आपका hard palate है, इसमें palatine rugae दिखते हैं. You will see palatine rugae over in the hard palate. So these are your palatine rugae, which is present over in hard palate. In the center of the hard palate, you will draw one elevation over here. This elevation in the hard palate, this is called as median palatal raphe. Median palatal raphe. Okay. Now, this is your soft palate. What is this structure which is hanging down? This structure which is hanging down, this is called as uvula. This is called as a uvula. What you're seeing behind this area is your posterior pharyngeal wall. What you're seeing as the wall of pharynx. Now, this you will be only able to see if the patient puts his tongue out. So, tongue patient की कैसे बाहर है? Tongue patient की ऐसे बाहर है. This is the tongue of the patient who is protruding the tongue out. अब मैंने आपको बताया tongue के दो पार्ट हैं. That is the anterior 2/3 of the tongue that you have examined. This is called as the oral tongue. And I showed you the oral tongue and what are the parts of it, right? And then posteriorly, I told you there are certain bumps or there are certain papillae which are present like this. And these are called as circumvallate papillae. Behind the circumvallate papillae, what do you see? That is your posterior 1/3 of the tongue, which is a part of your oropharynx. So posterior 1/3 of the tongue is also called as the base of tongue. इसे हम लोग base of tongue भी कहते हैं, which is present behind the circumvallate papillae. It is also called as the oropharyngeal tongue. Okay. In the center, this is your median raphe of the tongue. Median raphe of the tongue. Okay. Then what is below the tongue? The tongue is attached below by an attachment. This is called as frenulum, which we had seen. The tongue is attached below by an attachment called as frenulum. On both the sides of the frenulum, there are small papillae or openings, which are called as the openings of Warton's duct. Warton's duct का मतलब submandibular duct. So Warton duct opening, which are present on each side of the lingual frenulum, which is attaching it to what? To the floor of mouth. So this part is the floor of mouth. बस. तो ये खत्म होता है हमारा about the whole thing that you see over, and you can easily tell about these structures by drawing this simple diagram, and you can show any pathology related to what is there in the oral cavity as well as in the oropharynx. So this is what will give you more marks when you draw over in oral cavity as well as oropharynx examination.